Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what I bring to you all from the world of medicine. How internet and the various other online platforms are boosting up the children's well-being. Contrary to what many fear, the time children usually spend in front of a screen is often associated with a good quality of life. Yes, you heard me correctly. The concern that media access may be harmful to children and adolescents has been a topic of public debate since a long time before even the existence of the smartphone. Now, the basis of this new study is that children and adolescents spend most of the time online while also scoring the highest when reporting how happy they are with life. In the new analysis published in the journal New Media and Society, it is questioned as to how time online is linked to how children and adolescents feel. They look at both how the time online influences the self-reported quality of life and the factors that affect the relationship between the two parameters. This includes what children spend time doing online, including social media and games, but also social factors such as family, school, and socioeconomic status. A total of 1,000 children and adolescents between the age of 9 and 16 were interviewed for the study. The results did indicate that family circumstances, for example, whether there are strict rules about screen time or whether time is spent facilitating and discussing on how children use digital media, they all influence the quality of life. These findings did indicate that for children with a supportive family and school environment, a high number of screen hours is a positive finding rather than a negative thing when it comes to a good quality of life. Connection between maternal gum disease and preterm birth. According to a research presented at the Europerio 10, women with preterm births may be more likely to have gum disease compared to those with full-term births. The study also found a higher prevalence of unhealthy oral microbes in the preterm mothers. The study that I'm talking about, it compared the oral inflammation and microbes in women who delivered preterm, which is usually a period before 37 weeks of gestation, and those with full-term births. A total of 77 women were enrolled during the first 6 days following childbirth. Gum bleeding was assessed at 4 different sites around each tooth to evaluate either a gum inflammation. Now, in addition, the researchers even examined the pocket depth and even the loss of attachment at 6 sites around each tooth. Now, the plaque samples were collected from the surface of the teeth, and in patients with probing depths of more than 3 mm, they were also obtained from under the gums at different locations of the mouth. Now, compared to those with full-term deliveries, women who were preterm births had significantly greater attachment loss, a higher percentage of pocket depths, which was measuring approximately about 4 mm or even greater, and different populations of bacteria on as well as under the teeth. The researchers hence concluded that they found that preterm mothers were more likely to have lost the supporting tissues around the teeth. They have a higher proportion of sites with deep pockets and also have unhealthy oral bacteria compared with women with full-term births. The birth weight was significantly lower for mother with periodontitis compared to mothers with good oral health or just bleeding gums but with pathological pockets. That highlights long COVID symptoms in children up to 14 years of age. The largest study to date of long COVID symptoms in children aged 0 to 14 years, it confirms that children who have received a COVID-19 diagnosis can experience symptoms of long COVID lasting at least 2 months. The study is published in the Lancet Child and Adolescent Health. It used national level sampling of children and matched the COVID-19 positive cases with a control group of children with no prior history of COVID-19. In total, if I talk about the study, the responses from almost 11,000 children with a positive COVID-19 test result was matched by age and sex to over 33,000 who never experienced COVID. The surveys asked about participants approximately of 23 most common symptoms of long COVID in children and used the WHO definition of long COVID as symptoms lasting for more than 2 months. The most commonly reported symptoms among children of 0 to 3 years old were mood swings, rashes, and even stomach aches. While among 4 to 11 years, the most commonly reported symptoms were mood swings, trouble in remembering or concentrating, and even rashes. While among 12 to 14 years, fatigue, mood swings, and trouble remembering and concentrating were the various common symptoms. The results of the study found that children who were diagnosed with COVID-19 in all the age groups were more likely to experience at least one symptom for 2 months or longer than the control group, while in the 0 to 3 years of age group, around 40% of the children diagnosed with COVID-19 experienced symptoms for longer than 2 months. While if I talk about the 4 to 11 years age group ratio, there was about 38% of the cases compared to 34% of the controls, and for 12 to 14 years, 46% compared to 41% of the controls experienced long COVID symptoms. Hence, the authors stated that although the chances of children experiencing long COVID is still low, it must be recognized and treated seriously. How pregnancy loss is related to more prevalence of stroke in women. Infertility and pregnancy loss are associated with an increased risk of non-fatal and fatal stroke in the later life. This is in accordance to an analysis of observational studies that was recently published in the BMJ journal. Early monitoring of women who have experienced miscarriage or stillbirth along with healthy lifestyle changes could lower the risk of stroke. The questionnaires were used to find information on infertility, miscarriage, and even stillbirth. Hospital data were used to identify the cases of fatal stroke and subtypes of stroke. Overall, over 6 lakh women were included in the study, and the study results highlighted that among these women, 2.8% experienced a first non-fatal stroke at a median age of 62, and only 0.7% had a fatal stroke at a median age of 71. Now, women with a history of infertility were at a 14% higher risk of non-fatal stroke than women without infertility, while miscarriage was associated with 11% higher risk of non-fatal stroke compared to those who never had a miscarriage. Also, for women who had 3 or more miscarriages, the increased risk of non-fatal ischemic and hemorrhagic stroke was 37% and 41% respectively. Similarly, for fatal ischemic and hemorrhagic stroke, 3 or more miscarriages were linked to 83% and 84% risk increase. The researchers therefore concluded that the link between infertility and increased stroke risk may be due to conditions such as polycystic ovary syndrome, which is the PCOS condition that is commonly happening, and premature ovarian insufficiency, while endothelial dysfunction, which is usually the narrowing of the heart's blood vessels, may explain the increased risk of stroke for women with a history of recurrent stillbirth or miscarriage. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.